eating the same shit sandwich right now. You know, the Covid-19 sandwich. But we didn't have to. I know a lot of people who have been saying that it was something that nobody could have anticipated. And I find it very exasperating. Because if it couldn't, then how come it was? You know, Bill Gates, for one. And there is also one country that isn't eating this shit sandwich right now. It is Taiwan, and life goes on normally here without lockdowns. I say here because that's where I'm currently at, unable to fly out. Not that I would want to at the moment. With safety measures in place, life goes on so normally that when watching news from Europe and the US, I'm sometimes overwhelmed by a weird feeling like I'm living out the last days of our civilization. Kind of like Gregory Peck and Ava Gardner in that incredibly depressing classic On the Beach. You know the one, where Australia is the last place on Earth free from the radioactive dust from a nuclear showdown. But of course, it's just a matter of time before the dust will get them all. Taiwan is a case in point that not only could it have been anticipated, but also that it was possible to prevent this shit sandwich from happening in the first place. And by shit sandwich this time I mean the loss of life, the lockdowns, and the economic damage that we are still trying to wrap our heads around. Being here, I had a chance to observe up close Taiwan's response to this crisis. Back in January, I expected it to be in the epicenter of the epidemic because of its proximity to China, but that's not what happened. So let's examine briefly how they did it despite the odds being stacked up against them. There is a lesson in there somewhere, possibly for the future. If there is a future. I guess there will be a future. It might just belong to the rats and the cockroaches fighting for the world domination. Kidding. Of course it will be the rats. So, here is what Taiwan had going against it. It is on China's doorstep, and over 1 million of the island's 23 million citizens live or work in China. Every year, 3 million Chinese visitors from the PRC come to Taiwan. The early modeling of the spread predicted Taiwan alongside South Korea would have the second highest importation risk. Taiwan has also been blocked for years from joining the WHO, and anything it learns from this body has to be second-hand. Yet, despite these odds, Taiwanese response to the coronavirus was nothing short of impressive. The SARS crisis 17 years ago taught them a lot of important lessons. One of them was that they had to rely on themselves. The peculiar political situation meant that the WHO representatives did not arrive in Taiwan until 2 months after they were called in for fear of offending China. A system was put in place after the SARS crisis. When you land in Taiwan, your temperature is monitored by the quarantine officers at the airport. But on December 31st, they went a step further, and the officials boarded direct flights from Wuhan to check the passengers for fever and pneumonia symptoms before they were allowed to disembark. On the 20th of January, Central Epidemic Command Center is activated. Now, it was established in 2004, a year after the SARS outbreak. Like the name suggests, its function is to command and coordinate between various central, regional, and local authorities. Straight away, entry permits for tourists from the affected Chinese province set to arrive later in January are cancelled. Medical experts are also sent to Wuhan to find out firsthand about this new virus and the situation on the ground. Taiwan even warns the WHO that they suspect the virus can transmit from person to person, but they are ignored. Politics over public health. Go figure. I said Taiwan did not go into lockdowns, but the school winter break was extended by 2 weeks in February. It was done at the time when it really mattered. Remember, the outbreak happened just before the Lunar New Year, which is the time when millions of Chinese and Taiwanese travel for the holidays, many through Wuhan. When the world was still in denial, the Taiwanese government was taking time-critical preemptive action. Travelers to high-risk areas were put under home quarantine and monitored electronically through their smartphones. Patients' travel histories became accessible to all hospitals, clinics, and pharmacies. And so it went on as measure after measure was introduced. For a long list of 124 measures taken up until February 24th, check out the supplement of this Journal of the American Medical Association article. Let's look at some examples. Fake news and rumors. Anyone spreading fake news about the epidemic can be fined up to $100,000. Criminal Investigation Bureau questions suspects over the toilet paper shortage rumor and others about the coronavirus spread in specific hospitals or neighborhoods. Surely knowing that you may be fined $100,000 dampened the enthusiasm of anyone tempted to unleash their creativity on Facebook. Example 2. Face masks. They are critical for health workers, so they start rationing them after allotting enough for hospitals and medics. They purchase and install 60 new production lines in 30 days instead of the usual 6 months required. They send more than 1,800 Army reservists to man these machines and boost production in existing mask factories. The daily production goes from 4 to 10 million masks a day. The post office is charged with their distribution to pharmacies and healthcare centers. Example 3. Seemingly little things. Already in February, a $2 billion package is announced for businesses affected by the epidemic. The Ministry of Education announces that student absences due to fever or respiratory symptoms would not count towards the attendance records. Also, people like me get 30 days more to figure out what to do with ourselves as our flights home get cancelled. Well, thank you for watching. That was 7 minutes out of your life that nobody, unfortunately, is going to give back to you.